All right, should we get started so
Yeah,
everybody stays on time?
yeah, we can certainly.
Okay, let me just adjust this just a hair. There we go. Well, would you like to introduce yourself?
So again, hi, I'm Janna Vilen.
And I'm Erik Vilen, and we are together, I guess, the Doctors Vilen. And so we recently started Intuition Health, Sports Medicine, and Wellness, along Mike Johnston, who's also on the call as our physical therapist, health coach extraordinaire, strength and conditioning coach. And we're starting this webinar series, and we thought it was really important to start with muscle as medicine as part of what it means for a healthy life with longevity and performance.
And so one of the things we started with the webinar was, when you do social media, we'll talk about this a little bit later, but everyone kind of kept telling us to go shorter and shorter with what we were talking about. So we tried to do these super short videos and we realized we cannot, well, especially me, like I can talk fast and get a lot in 3 to 5 minutes, but we weren't getting across the information that we really wanted to. And so instead of trying to condense what we wanted into, a short form, we felt like that really wasn't us and that really wasn't appropriate. So if someone's getting their medical information, their health information, deciding what to do based off of a 30-second reel or even like a 3 to 5 minute video, we just like didn't want that to be what our clinic was and the physicians that we are. We like to educate. We want to give people as much information as possible. So we wanted to set up kind of an avenue where we could give all that information to patients so they can take that and then hopefully take that information and do something for themselves instead of thinking that that's the medical advice they're giving. It's more of like an avenue to get questions answered to figure out where to get your medical advice and healthcare from.
And so that's why we started this webinar series. So this is number one. And so a little bit about us. I think one of the things that's important, and one of the things for healthcare, is that when you go to a physician in particular, it's not always someone who's living it. And you sort of look at them like, oh, geez, like that's great advice, but you don't take your own advice. And so our goal is to live it and experience it and have those experiences and how we live our daily life and make it practical for people, and be the physicians that work out and get their sleep and manage their stress as best as they can, their emotional health, because all of that is part of being healthy. And so, well, we have to term this, sort of muscle as medicine. We want everyone to realize that it is a very holistic approach, and that all these pieces, as we'll talk about as towards the end, come together into how do we view our health, and in particular, how do we build and maintain muscle for health.
And so I wish I had one for Mike. I need to probably get one for Mike as well for a before and after. But this is actually, little stepbrothers-ish. But this is the first place we worked at on the left is actually the first clinic Eric and I worked at together. So we had a job where we did very traditional medicine. He worked in the ER and I did traditional primary care. What I thought was sports medicine is exactly what I thought I wanted to do. I said from leaving high school, it's like I want to do sports medicine in a small town. And so that's what we went and did. And 3 years in, I was like, this is miserable. This sucks. Like, this is not what I signed up for. So it's kind of a big gut punch when you spend all these years and you're like, oh, this is not what I thought it was. And we had about, I think, 3 months or 4 months where we actually had one day off together. We just worked that much. Like, this is not what we signed up for. This is not what we wanted to do. So that kind of started us down this different path of looking for something different. And I ended up at a different clinic that combine some different types of medicine. So looking at regenerative medicine, functional medicine. They had a gym, which I was sold when they had a gym attached to their clinic. I was like, no further. This is where I want to work. This was in Minnesota, where we were from. And so I was like, this is possible. It's possible to have fitness as part of your practice. And kind of fast forward a number of years, sometimes stuff happens where it's not something you want to experience again. And jobs aren't always what you think they
Yep.
are, but sometimes you end up then where you are probably meant to be, which is we finally opened our own clinic. And we were trying to figure out how to tell people what we do. And the crux of really all of it was is part of this came from conversations I've had with Mike as well, is like, what do we all have in common and how do we get here? And we work out, and everything we do in our lives, whether it's making sure we get adequate sleep, rest, recovery, all those things Erik talked about, nutrition, functioned around like is around this centerpiece, which was like exercise was just absolutely crucial to how we lived our lives. So how we treated pain, how we treated our injuries, all of these things mattered. And that's really where this muscle as medicine, functional fitness came
Yeah.
from.
And Jan and I both really came from more of like an endurance background, right? She ran a bunch of marathons. I was doing long distance triathlon, including the Ironman. And we didn't have that muscle centric focus. But over the years, for our own personal, somewhat selfish reasons, it became really apparent that we had to focus on building muscle. And as this journey of how do we help take care of patients and educate patients from our own experience, it just became so obvious that this focus on muscle had to be really one of the keys to long-term health and prevention, not only of injuries, but of chronic disease and helping people in their 30s, 40s, 50s, 60s be healthy and well and fit in their 70s and 80s. And so that is sort of the journey that we're on, both personally and professionally, and how we have really changed how we look at what is muscle, how is important, and how do we help people with that journey of keeping muscle all the way through their life.
Really what happened was I had started my husband skinnier than me group a number of years ago when he was so skinny from doing all of his triathlons and he was able to put my pants on. And so I'm not a very big person. And so when your husband comes out with your jeans on and you realize like, oh, wow, my husband is skinnier than me. And there's a lot of women who was in that group. So that's why we started building some muscle. So,
So, um,
so this was just a quick thing about, I mean, why listen to us? I mean, that's, I think, what everyone asks is you hear all over the social media and all over the news now, like physicians do not get any training in nutrition. They get no training in exercise. You get no training in lifestyle. And it kind of makes sense because how do you tell a bunch of sleep deprived, super stressed out people eating cafeteria food at a hospital, like, let's learn about lifestyle here? I mean, it just doesn't make like any conceptual sense that we were a good group of people to take that information in because we probably would have all quit if we actually knew how detrimental all of it was. And yes, they've changed the work hours and stuff, but just from a conceptual standpoint, like we didn't learn that. And so just remembering that those of us who chose to go get training, we didn't just randomly read a book or, follow some social media influencer. There's a lot of training because we know that if you're going to go against the grain in medicine, if you're going to go against what everyone's saying, you have to do a deep dive and go into that research yourself. And that's probably one of the benefits we have is all these extra years allow us to figure out how to read an article, like scan through it really quick, know if it's legit or not. Is it something then that we can take and apply to our patients? And how do you collect all that information? Know how to sort through, who's a legitimate doctor talking about it or a researcher or, put your background on there, whatever it is. How do you know that? And then be able to actually say, I'm going to listen to this person. And maybe I don't believe everything they're saying, but I maybe believe part of it. Or how do you start to navigate that world for yourself and then for your patients? So just know we've done a lot of additional training outside of just medical school residency fellowship where we got none of this. We did a lot of this on our own, reading a lot of books, a lot of podcasts. And then obviously, ourselves, we live this very much so.
yeah. And I think that that is, this bridge that many of us try to find between sort of your traditional medicine, where it's a very disease-based process and treatment into prevention, and what does that look like is hard, right? And it doesn't mean that we throw out everything that Western medicine does, because when you are in a car accident or you have pneumonia, like you want that available to save your life. But there are a lot of things I think we all know, everybody who's on here, that are not the best advice or detrimental to preventing the chronic diseases that are now sort of the scourge of our population. And so I think it's just always important to recognize that we're not throwing one thing out completely and replacing it with another, whether it's chiropractic or Western medicine or acupuncture or nutrition. We really need to take a critical look and a nuanced look at how do we apply that to this person in these general principles so they can live their best life.
Yeah, so really a focus on true prevention. So early detection is still really important. That's a big piece of Western medicine. So early detection, but then backtracking that even more to that true prevention. But what tests are actually needed to understand, when do you need intervention?
Yeah. So that's sort of like the background of where we come from. And I think, right, whenever we talk with people, it's helpful to have that context. And so sort of transitioning into why do we care about muscle so much? I mean, when we're in our early 20s, we generally all feel great, which has changed a lot over the past 30 or 40 years about the health of even our young folks. But we're at our maximum sort of muscle mass in our 20s and 30s. And then we get this age-related decline. And that comes with a lot of problems, right? Most people just think of it being about mobility, or they, can't pick up, a garbage can. But really, this decline that you see accelerates a lot. And when we think about things like what do people die from, right? Risk of falls. I mean, if you're in your 70s and you fall and break a hip, your likelihood of being alive in a year is about 50-50, and it's about 25% in 3 years. So those are the type of things that we start thinking about now when people are in their 30s, 40s, and 50s, because those in our mind are preventable and to a large part. And so we want to make sure that we're looking not at that, but how do you function, right? Nobody, I shouldn't say nobody. I haven't met too many people that want to end up in a nursing home, right? And so whether they have a broken leg or they end up in the hospital because of, chemotherapy, those muscle mass metrics and how we think about that really make a tremendous difference in how that person recovers and keeping them at home and independent, which is really when you talk to people, that's one of their main goals in life, to be independent and at home.
And this is where we kind of, I think, our combination. So Erik's background is family practice. I guess we didn't say that his did family practice. I did family practice with a year of sports medicine. So my specialty is non-surgical sports medicine. But that clinic I found in Minnesota that had the gym attached, we did what's called interventional regenerative orthopedic. So that is not using steroids. It's not using a bunch of cover-ups to treat injuries. So if someone gets arthritis or they have an old ligament injury, those are things that eventually lead to loss of muscle mass. If you have to have surgery or you get sick, those are things that lead to loss of muscle, that leads to loss of function, that leads to dependence. And so it's having these different avenues of separating Western medicine, yes, when you need intervention versus not, but also what else do we have to fill this gap where maybe we don't want to use Western medicine yet, or we don't need that, and we have these other things and maybe they're not enough. When we're looking at treating people's dysfunction, biomechanical dysfunction, how they move, how they actually exercise correctly, lift correctly. If they can't do it with just physical therapy or with personal trainers, sometimes they have enough trauma or damage that then that's where I come in and intervene. So that way they don't have as much pain and we're actually treating at the root cause versus just covering up maybe a pain symptom.
And muscle mass is it's going to go down, right? I mean, there is this process of aging that is inevitable. I see Mike shaking his head, but you're not, 250 jacked at 4% body fat anymore. You're close.
He's close.
But I think the important thing and one of the messages that we talk to everyone about and really try to educate people is you can really slow that process down, right? You becoming decrepit is not inevitable, right? There's so much that can be done to prevent that. So, like I said before, like nobody wants to end up in a nursing home, but they just don't know how to prevent it. And that prevention starts 20, 30, 40 years ahead of time. But if people have not done that, it's amazing what someone in their 70s who's never lifted can do, right? And the studies show that. We see it in our practice. Their improvement is really profound. So we don't want to discourage people that are in their 60s, 70s, or 80s from, getting in the gym and lifting, but we would really love it if we could prevent a lot of that. So we didn't even have to get to the point where there was a consideration that they weren't strong enough or didn't have enough muscle mass to be independent.
And we've all seen someone suffer like that, right? And I think that's what happens is we all see it, we don't want it, but people aren't even they're sure what to do. They're not sure where to start, who to go to for that information. But also I think the big piece is just kind of this, when we say muscle, we should we're not talking about everyone has to be a bodybuilder, right? We don't mean that. We just mean you need to have enough muscle mass to have it be metabolically active to keep you healthy and keep you moving, doing what you want to do. So just trying to think about muscle a little bit differently. There are these ideals in everyone's head when they hear muscle, and we don't mean that. We just mean, having enough muscle mass for what you need to be able to do and being able to learn how to lift so you can do other things safely and exercise as well. I mean, be active, go hiking, all of those things require muscle.
I mean, in our view, muscle is medicine, and it really is a metabolic organ. And I know that the textbooks don't necessarily view it that way, but I think we definitely view it that way. When you look at all the things that muscle does that is helpful and in your overall health and prevention of chronic disease, right? It is the main depot for your blood sugar, right? There are various types of insulin receptors. So developing insulin resistance is primarily a muscle related issue, right? Inflammation, getting up, moving, right? That reduces inflammation. Exercise reduces inflammation. Hormones, health, whether you're talking about, again, something like insulin as a hormone, or you're talking about something like testosterone, right? We're talking about hormone effects on muscle. And so those are really, I think, the big things when we think about an organ, right? It affects a variety of systems. And our muscle mass is a great predictor of our overall health and our strength, right? So they're somewhat different, but closely related for a lot of people. When we look at things like weight or BMI, right, your muscle mass far exceeds it in predicting how well you're going to live than any of those muscle mass metrics. And in our practice, we have our own DEXA machine, and so I am very particular about what does that muscle mass look like at various stages in life to ensure that someone is independent and strong.
Yeah, and this goes muscle. I mean, I think textbooks say it, people just don't actually apply it, right? So there's a lot of stuff that are in textbooks about biochemistry and actually how our bodies work that everyone just throws out the window for some reason. And so we've for some reason thought muscle's importance is only burning more calories than fat. Like that gets said over and over again, that the more muscle you have, the more calories it burns than fat. It's like it's not really true. I mean, it's sort of, but not in the context of how people are thinking about it as a very simple math equation. Our bodies are very complicated. They're very complex. Muscle works by using energy differently. It uses it more efficiently. It keeps it from getting stored as fat. And then it sends different signals. So for some reason, if you were able to have a lot of muscle and do nothing, you're still not much healthier, if you have muscle that you're not using. Now, obviously, get that muscle, you still have to do something to get the muscle. But I think it's that concept of you still have to move. And we're so sedentary as a society that now that if you get up and move like every couple of hours, even if it's for 30 seconds to a minute, it shows that there's some benefit. Like you get healthier if you actually get up and move every 2 hours. Like that's just how unhealthy we are and how sedentary people are, that they will literally sit for 8 to 10 hours a day not moving. So if you go to the bathroom every 2 hours, you're like doing good. You're doing better than the majority of people. So we like look at these studies like, oh, this is great. It's like, no, that's just how unhealthy we are now because people aren't moving anymore. So it's trying to change that thought process too about how important little movements are throughout the day.
And right, muscle supports a lot of other things around our body. So, right, improve blood flow, cognition, right? Movement, exercise is one of the, if not the best way to preserve cognition throughout the lifetime. And memory, focus, I mean, depression, anxiety, right?
Sanity, that's why we worked out so much.
Sanity, but right, exercise, and you look at the studies is pretty much equivalent to almost any antidepressant or anti-anxiety medication in terms of treatment of mental health. But it's not something that most people do or think of it.
Well, because we worry too much about how much should you do. It's like, just do something. Everyone wants to know like exactly how much to do. And it's like, just do something. At this point in time, doing something is better than doing nothing. And that's just kind of the picture trying is just how do we get people just to get up and moving and do things safely in a way that makes sense? And then when they get dialed in, we'll talk more about like what exactly we do to help people dial in to be efficient and productive in their workouts.
Yeah.
And so strength, I mean, the stronger you are, it supports your joints. Most people have heard that, like, less weight, less weight, less weight, but also the stronger you are. So the stronger you are, it's going to support your joints. When your joints are doing well, your tendons and ligaments are doing better, your fascia is healthier. So fascia is kind of this, again, missed piece of, in quotes, all of our muscles. So there's kind of new concept instead of 600 different muscles, do we really have one muscle in 600 different fascial pockets? So fascia is super important for our muscles as well. They can't work well if the fascia is not healthy. So we're looking at all of these things for maintaining our mobility, maintaining our independence. And so this is where muscle, we're looking at, okay, when we're starting programs or advancing, body awareness, foot strength, what does it really mean to activate your core? Balance and coordination gets missed a lot. So people will lose their proprioception as they get older, but you can retrain all of that in a proper program. And then it also prevents injury and falls. I think we went through all this. I mean, really, this is just, I think, absolutely critical that it's never too late to start. The more you do, it's just, we kind of are a little backwards where people will, a lot of times will say, I'm going to start running to get healthy. It's like, well, maybe not. Maybe we start with working on balance and foot strength and ankle strength and body awareness and body mechanics and even just some lifting weights where maybe you're at a machine or someone's helping you. So we're a little weird that we think that you have to like run or do some kind of like boot camp 6 days a week to get healthy before you can really start to lose weight or start to get strong and lose weight. I don't know. It's just kind of a weird concept to me that we think we need to do these high level activities that are very hard to do actually. Like you're on one leg when you're running each time you take a step over and over again. And that's why the injury risk is so high. So trying to just think about these things a little bit differently, get back to the basics and think about this as a journey over your life then, oh, I have 3 months to get to this weight. Like that's just that those goals don't work very well. And that's why a lot of people will lose a bunch of weight and then not be able to sustain it or gain it back as our goals aren't very functional. And that's why we had part of our program and part of our clinic was absolutely having a health coach. Was we can tell someone all day long, here's all the things you need to do. It's that implementation piece that gets missed. The implementation, the accountability, the check-ins. And it's not that you want a coach to tell you this is exactly what you need to do. Here's what you're going to eat every day, because that also doesn't work in the long term. You need someone to teach you how to do that. And that's really where this functional fitness concept came from for us, which was the muscle is medicine. That was our core of everything we do health wise around maintaining that and not getting injured and keeping our muscle mass. But this functional fitness, which is what is your purpose? What's your goals? What do you want to do with your life? What do you want to be able to do with your life? And us starting to think about that because sometimes I guess doing triathlons and doing endurance races could be your lifelong goal, but we're like, that's not exactly what we want to be able to do. And you start to think about what that purpose actually is. And so that's really what this is what is your purpose? What are your goals? How does your fitness program fit what you need and make that training to be specific to you?
And that right, that is so key. And I guess coming back to like the health coaching
Mhm.
piece, right? Like finding that map, that mission aspiration purpose for people to be consistent is really just such a key part, right? And then being able to put that into daily life, how do we integrate that into daily life is really, if you don't have that, you're not going a whole lot of anywhere.
Yeah. Most
So
of this we talked about, right? So preventing
yeah.
injury, reducing pain, these before you ever get pain, you've already had usually poor compensation patterns. So that's part of with, having a physical therapist as our coach, myself with my training, Eric some sports medicine, but we're really looking head to toe at these functional movement patterns because a lot of times wherever someone has their pain from, that's actually not their only source. It's looking at, well, what happened in the first place? Where is the pain and what's happened because of the pain and trying to get that all together because if you have an injury or something hurts, it's really hard for people, wakes them up at nighttime. It's hard for them to be motivated to work out. They can't do what they like to do. So they set them down this downward cycle where all these other pieces start to fall and we're trying to build those pieces back up.
And so I think we all know or had experience as to why traditional approaches kind of fail. I mean, a lot of these, you go to the doctor's office and they want you to say, oh, you need to lose 20 pounds. Well, they're focusing on weight loss. They're not focusing on muscle health, body composition, how functional you are. That's just like a metric on a checkbox that they have to fill out and they get dinged if a certain percentage of their patients are overweight or obese. A lot of programs are either, right, you do all cardio or you do all lifting, and those have their advantages for very specific reasons, but from a functional standpoint, most of us live in the world where we have to do some of each. And so most of our traditional approaches don't do that. They are a one size fits all. None of them talk about sleep, stress, hormone optimization. How do you actually recover? What does recovery look like? How do you measure it? And so all these important things that are sort of the not actively exercising that figure into your overall health and maintaining muscle and being consistent about it are missed in most of our traditional programs. Um, and there's the saying in just about every field, like what gets measured is what gets managed. And so we don't believe in guessing about really much of anything. And so our program and approach and sort of overall concept is we need data that's specific to the individual, right? We're all individuals. Cookie cutter programs don't work. What does that look like? So we again, we have our own metabolic cart. I do all our own VO2 testing in house. We have our own DEXA scan, which is super important, biomarkers, hormones, everybody, whether they're in for knee pain, weight loss, I mean, whatever it is, we talk to them about sleep, exercise, nutrition, community, right? Having that purpose, who's going to help you be accountable. Janna and Mike do movement screening, right? For people who, again, can't jump into and shouldn't jump into going to the gym. And then again, always bringing it back to what's your goal, right? What's your purpose? Because without that, you're gonna go 3 weeks. What's Quitter's Day? I don't
Oh,
know.
it was the second Friday.
Yeah,
Yeah, it's like the
like
thing in January.
New Year's,
Yeah.
most people make it like 2 or 3 weeks, and then their resolutions are out the window because they're not tied to a purpose in life, which is so important.
And that's different than a goal of like, I want this weight on the scale. I mean, that's, I think, what we're trying to figure out is how do you really dial in when someone says, I want to be this weight? It's like, well, what happened at that weight for you before? Like, what do you think happened if you're going to be that weight? What do you want in your life if you're that weight? And so you start to really dive in and kind of peel these layers away of what people are looking for. And so that's what we want to help them do is talk to them about, it's not just about weight loss, it's about fat loss and muscle maintenance. And can we flip that script and say, okay, let's focus on gaining muscle instead of just losing weight to a number and trying to help change how they're looking at what their goals are. So maybe because a lot of people just feel like failures, and we don't want that. We don't want the shame and guilt. We want to help them flip the script in their head and the power of positivity. And this we already went through. I mean, this is just treating early. I mean, I think if you have old injuries, it's worth getting assessed. This is something we try and just emphasize over and over again. And when you're talking about, pain medications, over-the-counter medications, steroid injections, they have a lot of harm. And so when that's your option or surgery, we're trying to backtrack from that and say there is something to fill that gap. There's physical therapy, there's training, there's other things that are more hands-on manual type things. There's work you have to do, but there are other injection-based therapies that help your body to heal. And part of that is having a healthy body to allow that. And that's why we melded these two things together.
So, right, functional fitness is a system, right? I think a lot of people just think it's functional movement, right? It's way more than that, right? You have to sleep to order to recover and repair. Stress, it affects everything. And I think, looking back for us, like we didn't realize, like going through residency and then getting our first jobs where we were still working crazy hours, like we didn't realize that until we had this like 2 year period where we're like, oh, like you can be on a regular sleep schedule and feel better. Right? The appropriate nutrition for you fuels muscle growth. You're matching your biology and your training and aligning everything together so that it is not a fragmented sort of plan. And I think that's a challenge in this day and age to not have sort of a fragmented health plan because your physician is generally not connected to anybody else that you're getting or seeing healthcare from. I mean, that is just sort of the way it unfortunately is. And being non-judgmental about where you start, right? Starting is the hardest part for so many people, and then getting through those first 2, 3, 4 months until you've developed a habit and been successful, right? That success is so important, even how little it is. is so critical, and being realistic, right? Like Mike doing SMART goals with people to have them be someplace where they can be set up for success is just so critical to staying with this and having it develop from something I'm doing to something that I do every day.
Mhm. And change is hard. And we understand that. Like, we want to not be the doctors who are like, well, just lose weight when you come back a year later and haven't done anything. Well, just lose weight. Like, why can't you? As we're sitting there with pot bellies, like we just don't want it to be, we don't want that to be us. We don't want that to be our practice. And if we can't practice what we preach, we don't feel like it's appropriate for us to give that education. But we do understand change is really hard. And so we're trying to set up to help people with that change so it does become a habit and something they do every
Yeah.
day.
And so this is sort of our what would be called a whole health like system of approach, right? And so all these things are are related and they're different for everybody about where they might want to start. We feel strongly, right, about being able to have muscle, right, this movement strength part. So many people sort of focus on that and forget about the environment, the personal growth, the sleep and recovery, the stress regulation that are so critical to being able to do the movement and strength. And so in our mind, these are all part of a treatment plan for everybody, and they get to sort of, although they come in oftentimes because of a movement issue or pain, right? Where we start with that treatment from a long-term perspective, and how do they change their life and how they stick with it is one of these areas.
Well, so I mean, the reason this is looking like the gears is so everyone has their pillars, right? So everyone has their pillars of health. And, we all, Mike and the two of us, we all worked at the VA where they had this whole health model where they had these different areas. And they looked at this circle and it looked like everything had to be equal, and they're not equal. That's how people kind of present these pillars is here's my pillars of health that everything's equal. They're not equal. I think of them more as gears where you get, okay, which one for that person might touch the most things, what might be the biggest, and what gets things moving. So that's part of our job. That's part of Mike's job. And that's part of our patient's job is we can help, but our patients have to do a lot of work. And that's probably been one of our biggest struggles is we want people to do work. We're asking people to do a lot of work. We're there to guide them. We're there to help them. We're there to make their time management better, more efficient. But we want them to do the work. But we also want to figure out which gear, if they get it going, is going to start moving the other gears. And as more gears get moving, others keep moving. And so we want to have all the gears moving. And sometimes one doesn't work very well. Okay, now we can address that. So it's trying to target whatever gear or two gears for that person that's going to get the most things going for them. And that's really where some of the coaching comes from and our assessments, because it depends person to person, which is why listening to a 30-second reel is really hard because they don't know your purpose. They don't know your goal. They know nothing about you. So you don't want to take your medical information from that.
And when all those gears start moving and functioning together, right, you're in a place where your muscle mass and overall health is like your currency of aging, right? Your muscle is related to your health span. There's just absolutely no question about it. And so, right, your muscle, and when we say muscle, most people are thinking about your quads or your biceps or your delts, right? Remember, your heart is a muscle, right? Your diaphragm is a muscle. And all of these things that are other muscles that we don't traditionally think about have a massive impact on your quality of life. And so we have a more global sort of view of what muscle is, right? It's about protecting your brain and your body from developing chronic disease, keeping your independence, and keeping that health span along with the longevity. Because right, most people want to be healthy as long as they live, and so that's the muscle is really a longevity organ that we can foster and train, and is highly malleable, and we have the ability to have people just get so much better by prioritizing that, and it doesn't matter where they start, right? In those gears, how little they start, that is how we get there.
And so this is how we set up our clinic. I mean, this is why we went on our own. We knew we couldn't do the type of practice we wanted to do in a traditional model. We tried, we even tried in a private practice that was a combo insurance cash-based model, and you just can't do it. You're so limited. You spend all your time talking about insurance and why insurances might cover or not cover, and it just gets really frustrating. You can't actually do what's best for the patient in front of you. And so we knew when we were going to go on our own that we really had to change and that we couldn't have the insurance companies dictating what we did. We wanted to have time with our patients. Like we might be able to tell you a diagnosis very quickly, but we want to have the time to explain to you what that diagnosis means, what other tests you need to have done, how do you implement that. So we want to have the physicians ourselves having time with our patients. We want that data. We want to be able to get that test. That's why we have our own DEXA machine. You couldn't get one in Montana. You could not get a DEXA for body composition in Montana. So if I wanted to know what mine was, I would have to wait till I'm 65. And
You
then
couldn't even get it for body composition.
no, I would have to
Oh,
till
yeah.
65 and I couldn't get it for body composition. But by then, I mean, right, like I look at my mom and my grandma, well, good. I mean, they're both these tiny little ladies with like osteoporosis. Like I'm already gone. So like it was like this. I wanted to start so early that's what's sad is we had to go get our own DEXA scan basically for anyone in Montana to be able to get this.
Yeah, and it's data driven. I think one of the good things, and people can relate to numbers, and it's really about getting the right numbers, right? It's not the number on the scale. It's your visceral fat, it's your muscle mass, it's your VO2. So that data driven, and it really helps people set goals too, right? They can look at that number and they can put in the work and they can see that number move, even if it's not moving quickly, right? It gives them that positive reinforcement that the work they're doing is making a difference. And that is really key for sustainment for so many of us, myself included.
Yeah. And that includes the biomarkers. So the labs that we look at are beyond just the annual physical labs. Those are really, again, kind of more early screening and really to say, oh, by now your numbers are bad enough that a medication outweighs the risk of having this bad number. So when we're looking at risk benefit ratio, we kind of wait till numbers or labs are bad enough that a medication is now needed. And that's not how we want to look. We want to start looking at trends over time. There's certain labs we can look at that 10 to 15 years. You can predict if someone's going to have diabetes, really starting that early prevention. And it's never too late to look at those numbers a little bit differently. So we want those numbers. We want the data. We want to be able to help people follow those over time. And so that way they can do the work and see the work they're doing is meaningful.
Yeah. And so, right, I mean, we built this clinic because there was just nowhere else to get it, especially here in Montana, right? So this is the only we have put together. It's the only place where you can get a DEXA scan in the state for body composition. It's the only place in the state where a physician is going to sit down and go over you with your VO2 test. And I run all our own VO2 tests.
There's not that many places that do VO2
right?
anyway.
Because
So
there's only like
places,
two in the state. So and there's other places, right? I mean we talked to Mike. It's been still challenging to find places in Idaho to be able to coordinate for people to be able to get this. And so that is this functional fitness model where we really want to focus on prevention. Yes, there's a role for early detection, but really prevention from a whole body approach. And that really takes data. It takes a health coach, a strength and conditioning coach. It takes a sports medicine doc to be able to treat all these areas and help people come up with their own plan, right? I mean, that's what health coaching is helping people come up with the plan. We guide them with the data, and we say, okay, this didn't work as well as we had hoped, and we, make a change, and then we look at the data because it's an evolution for both us and the patients because everybody's so unique. Oh, my slide isn't working. There
we go. And the way we had set this up was for our clinic was we have an intro visit, and this is just usually this can be by phone, it can be by video, it can be in person. And this was meant to see if someone's right for our clinic because it's not right for everyone. And so some people just don't want to do the work or they don't understand how much work goes into it, or they really want their insurance to cover everything. And so part of that's just making sure that we're a right fit for our patient. And then we developed our own physical. So our Intuition Health Span physical is what we set up so someone can get all of those data points. So it is subjective as well. So we focus on the data about how someone actually feels. And that's where the coaching comes in. That's where our follow-ups come is how do you feel? Like, are you feeling good or not? That also really matters. So we want to combine that subjective and objective data. And then the time, because sometimes that physical is just really looking at these numbers. And sometimes it is really having Dr. Erik as like your primary, because some people are looking for a primary care physician that fits their needs. And you still have to talk about early detection and screening. And there's lots of other stuff that goes into preventative health outside of just these things that are screening questionnaires. So we also want to talk through that and make sure someone's going into the right program with us, whether it's more intensive 6 or 9 month program with the coaching, whether it's a primary care program. So that physical is only meant to be set up for someone to get annually, or as an intro point to say, how are things, where do I belong within your clinic?
Yeah. Okay, so when we do our primary care, I think, we've spoke a lot about time, right? And one of the things that I spend a ton of time with patients, especially if they're already on medications, is what do those look like? And what's the plan if you want to come off of those? So, right, that is the time, right? That accountability partner is really important. As Mike and I might sort of put some sort of goals, short term, long term, right? How do we get there? And then if some of those barriers really are your knee pain, your shoulder pain that are really affecting your sleep, right? People think about it affecting, oh, I can't throw a baseball, but if you do not sleep well at night, that is a problem. And so that functional movement and sports medicine assessment is really a key part of this as well.
And then we just have a 6 month program that also is incorporated with, and this is just regular emails, it's education. And so this is meant to just be more of information for people to take and go back to either us or their coach or, whatever it is, and ask questions about it. So that way there's a lot of stuff out there. And when people are trying to sort through like what matters, we don't like things to be cookie cutter. This is as cookie cutter as we get, which is more just 6 months of general informational emails, and there's a ton of information, but really it's meant to be for you to go back with either myself or Dr. Erik or Mike as our coach to help you work through those. And then we also have, I'm actually a yoga instructor as well. Yoga hits a lot of those boxes on those gears for me. So that's why. And so having some yoga videos on there as well. And we're trying to grow that, but it's just hard when everyone's so individualized. That's probably been our struggle. We don't want to make it too cookie cutter, but we want to have a way to give people a lot of information that they need.
And one of our messages to so many people is
This is my mantra.
this is Janna's mantra, right? Self-care is not selfishness. Lots of people spend time taking care of everybody else other than themselves. And they just say, oh, I don't have the time, right? Remember, self-care is not selfishness. And it is so important to remember that as we go about our day-to-day lives.
Yeah. And part of us doing this is also to try and grow a community that it's okay to take care of yourself. It really is. People kind of, I don't know, put themselves on pedestals when they don't sleep very much. And society kind of does that. Oh, this person doesn't sleep. Look at how much they work. We consider that to be successful. But a lot of times then they make all this money and then they go back and they have to like fix the last like 20 years of their health. And that's the people who are our influencers right now, is who destroyed themselves, but made enough money to then spend their entire world biohacking and trying to fix all the problems they cause. It's like, let's not emphasize that. That's not what we want to do. That's not the majority of Americans. Let's build a culture and a society that it is okay that when we go to our son's soccer game, we're the only ones who bring our lunch and go for a walk in between games. It's really sad. I wish everyone came with us. Like, that would be great, instead of going out to eat and getting a burger in between games. But this is what we're trying to build.
And so we are going to be, you know, going with more of these. And so part two that we're going to have next month, and we're going to talk about HRT. And there's a lot of social media, there's myths, there's marketing, and then there's medicine, which sometimes hasn't given the best advice to people when it comes to that as well. So I hope you guys join us. That's going to be February 12th, again, 6 o'clock. And this is part of our movement to really build a community of people that are looking for self-care and being proactive about their health.
I mean, we have about 15 minutes if anyone has questions. And again, we want to make this not like true medical advice, right? Like, we're physicians, but this is general, as they always, I don't know what the disclaimer, this is general informational purposes only. So we're happy to answer any questions that you guys have. We just want to try and make sure that it's not asking for medical advice, because that's kind of, again, why we're doing what we're doing. We want to educate you so you can find the right person. But unless we can ask you a whole bunch of questions and go through a history, it's really hard for us to give answers when it's regarding like, what should I do? So if you can be general about it, we can help you as much as we can. Or if you have any questions about what we put in the PowerPoint or anything else, I guess, that we can help you answer. And yes, I talk really fast. Erik does not,
I
so
do
it kind of
not.
evens out. So I don't know if you guys were turning your, going 2 times speed, half speed. It's just us. And I think can you guys come off? You guys always type
Yeah,
your
you should
goal.
go.
You can always type in your chat. I don't know if you can come off of mute.
Mike, I know you got something to say.
I was just gonna say, when Janna talks slow, it's really frightening.
It is weird, isn't it? I know I told
I've
you I
heard
tried
it.
so many times.
I've heard it. It's
It's
a little
weird.
bit.
I just pause it more. It's just really awkward.
There was no, I don't remember which slide it was. If I saw it, the health coaching is really important with regard to people setting up their expectations for themselves and then learning how to hold themselves accountable. Personal trainers are great for holding you accountable in a very certain place. A nutrition consult, if you can get a good one, like David, is good for holding you accountable in a very certain place. But a health coach really doesn't come to the conversation with an expectation. The health coach gives you some background questions to ask yourself. I use a tool called the personal health inventory. And then we have a discussion based on your higher purpose in connecting your goals to your own personal values. Then when you're committing to something, when you're committing to a goal, you talked about Quitter's Day. I think it's like the second Tuesday after the new year, somewhere like that, or 13 to 14 days after the beginning of the new year is Quitter's Day, where people don't, they say, I'm going to do it. They show up at the gym and then they're back on the couch eating a bag of chips. But creating a SMART goal, specific, measurable, actionable, realistic, and time based, and then learning how to take action steps, take small bites of the apple to get there, and then having the experience of falling down because we're going to fall short of our goal, but we have to learn how to get back up, improvise, adapt, and
Mhm.
overcome, find another way to get there. Confucius said, you don't, and he probably didn't, but some Western idiot said it and put his name to it. You don't change the goal, you change the action step. And that's what a health coach will help you do. They'll help you kind of be a little bit introspective and then teach you how to hold yourself accountable in the long run. And a lot of times when folks, they set that first goal and they start heading toward that goal and they make it, they'll ask me, well, can I use this type of methodology in any, you know, goal that I'm setting in life? And I'm like, absolutely.
Mhm.
That's the point, is that you learn how to hold yourself accountable. But certainly, as you just said at the very end there, Erik and Janna both, creating that community of people that will share information but believe in sort of, walking the walk, if you will, is really important.
Mhm. Yeah, I think it's a great explanation of, I mean, coaching is hard to, I think, explain. Like we've talked about that too, how it's not the same as a personal trainer. It's not the same as a dietitian or nutritionist. It's not the same as signing up for a 6-week program or a 12-week program where where something is handed to you. That's not Coaching is hard work as well. It's a different kind of hard work than working out is, but it's hard work to hold yourself accountable, and it's uncomfortable sometimes. And we've had conversations that people just don't know really how to have conversations anymore. They don't know how to have tough conversations. And so then, I think sometimes internally how we present that and how we look at ourselves is also difficult for people to learn how to do that and hold yourself accountable and be okay that you don't have to completely guilt and shame yourself if you mess up. It's okay. It's part of life. And that coach is helping guide people along that path. Anyone else have any other questions, thoughts,
Yeah.
advice, feedback?
Yeah, this is we're always open to feedback, right? I mean, this is a new venture for us. So please send us an email. Let us know, give us a call at the clinic. Let us know if there's other topics in the future, format, things that we want to make this, right, a community effort, right? Yes, we're setting it up, but really this is about building community that can share information, like Jana said, and we in a respectful way, which we don't often see on social media or the news. So that is one of our goals with these webinar series as well, is that how do we have those conversations and education with people that might not have exactly the same thoughts. I mean, Jan and I disagree on stuff pretty regularly. And have discussions about patients like almost every day where we might have a slightly different perspective.
Yeah. So we're open to that as well. We want to develop this where, maybe you don't agree with us, and hopefully being comfortable eventually as you get to know us too, asking those questions of this is what I learned or what I thought, and having those more of an open forum conversation, especially at the end, about looking at why we've come to the terms we have. And we change our minds a lot. Like there's a lot of stuff that when I showed that first picture, there were a lot of things we did, that was almost 15 years ago, I think we figured out. Yeah.
15 years.
There was a lot of things we did back then that we don't do now. And there's a long, usually a very lengthy explanation of why, but we're always open to new things and changing our minds.
Well, thank you all so much for joining us. We appreciate you taking your time out of your evening. And oh man, I see a dog.
Yeah.
Our dog has been like hitting our hands this whole entire time, like wanting to be petted. And so it's good. Someone else has a dog on screen. Yeah,
Violet.
Oh, there comes Violet. Yeah. So, all right. Thank you all so much for your time tonight. We hope you join us next month or reach out to us. We're always looking for people that have great conversations with. So we appreciate your time.
Thank you.
Thanks.